As we wait for participants to reconnect now, I was live on the Facebook page with a few participants and I wished everyone the best of the new year. Of course, I wanted that to be a separate video so that the link can be shared separately to wish everyone. This link is definitely this video, which is actually streaming now, is the one for the professional issues webinar. The webinar number 1, regulatory bodies in physical therapy and especially with respect to India, the Physiotherapy Council. So this is a very important topic where the foundation is definitely, it is my individual perspective based upon my own experience of teaching and interacting with various levels of physiotherapy professionals in every part of the country. But I am also looking forward eagerly to receiving your inputs as the comments so that we can have a very wonderful exploration of what can be the challenges and what could be the strategies to handle specific issues of the council, especially in physical therapy. So I'm waiting for participants to join in now. So during this time, take your opportunity to observe the lights, the background, and of course the foreground, which is the visceral printed t-shirt. This is a special edition t-shirt for the visceral somatic manual therapy. The course begins on 10th January 2022. We have 1 week now, and then it's a full-fledged course with bonus anatomy, visceral anatomy masterclasses. So it's a very exciting thing that we are holding a free webinar on the visceral oriented perspective, be it osteopathy or manipulation or viscerosomatic manual therapy, from a manual therapy in splanknology perspective, where splanknology is the study of viscera. So now coming to the topic, the professional issues and regulatory bodies and the council. So this is the scenario. First and foremost, I want to just check if my audio and video are fine. If the viewers here can comment that things are fine. Dr. Girish sir, welcome. Wish you a very happy new year, sir. Keep inspiring, keep motivating, stay cheerful, stay smiling, and stay blessed. Yes, right. We have a scenario where these professional educations, why this professional education has to be regulated, the first thing. First and foremost, everyone will be very aware of is the fact that we are healthcare professionals. So regulating that is very important. If, for example, technical courses or courses like engineering or computer, these kind of courses, if that has to be regulated because the quality of machines have to be proper, imagine how much the quality of life of individuals is important. So for patients and also for normal individuals who are taking different types of treatment methods or even investigations, they always go to the healthcare provider. So every healthcare profession goes through a program of education and training. Some of the supportive healthcare professionals, they don't do a degree. They might do a short-term certifications and training. Those need not be regulated because they are very short-term and they are focused only for specific needs of the healthcare. It's not going to have a responsibility much. If examples are like the ambulance, we have paramedics who actually give the resuscitation or give the oxygen therapy or transport the patient from the road to the ambulance and ambulance to the hospital. They did not do a degree, okay? So they can do a short-term program and they are happy to just do that same work every day. whatever type of patients, it's only this category or that category. So patient is breathing, so what to do? Not breathing, what to do in the ambulance? If the patient is, the pulse is not there, so what to do in the ambulance itself? And of course, if the patient is bleeding, any kind of wound anywhere and it is excessively bleeding, so what to do? And of course, the fourth aspect is the patient is unconscious totally. Okay, so then what to do? So these are all the things which they are told basically, and they handle it in the ambulance. So we don't need a big regulatory body for them. But when it comes to as a qualified healthcare professional who is consulting with the patients and providing them with the treatment options, and the patients obligate themselves that this therapist is going to change my health status, and my functional recovery depends upon this doctor, the physician, a physical therapist, a healthcare provider. So in that case, such professions need to be regulated, because we don't need underqualified or non-qualified people doing the same treatments. Some of them even identify themselves as a specific practitioner, but they may not be having that certificate at all. Okay? So there are a lot of issues with the quacks. That means the quacks are called as the fake or the underqualified professionals. But to say underqualified, what is the basic level of qualification that is required to do a basic treatment methods? That has to be defined by the regulatory body. Why the regulatory body is needed? Because government can't do everything directly. And government is including only the what is called as the bureaucrats, politicians who are actually not qualified with that particular profession. So they can't regulate that. They cannot say what is good, what is not, what's to be included, what is to be excluded. They cannot say that. So the regulatory body, what it does is, it is comprising of people from the same profession. This is by definition. However, those people who are in the regulatory body will be mostly from the government-based institutions. They will not be from private institutions. Okay, trust me on that. And then the next one, because it is the basic idea behind is the government to control the functioning or the educational system or the practice system of the particular profession. So that is the idea. So although these professional members are there, the same professional members, they only can actually suggest or recommend. But there is a different level of committee where they actually approve that. And moment they approve, the changes in the regulatory body, what is actually being proposed or in documentation, it's been released, will be passed to the Parliament. So then it gets approval as part of the Ministry of Health or the Human Resource, the Ministry of Human Resources under that. And then it gets passed in both the houses. In India it is the Lok Sabha, the lower house, and the Rajya Sabha. Then it becomes the Act. So for forming a council also we need a Council Act. If we need a big changes in the council also, the Council Act has to be amendment of that act. Okay, so the change, the amendment or a revision of the act, it has to be approved by the parliamentarians. So remember that. What is the importance of the regulatory body? I have already told you. If you are seeing from A to Z, because all the professional issues, I have kept some topics. I have kept student issues, teacher issues, college issues, infrastructure. Remember, who decides that what should be the quality of a teacher? Qualification of a teacher? What should be the qualities of a teacher? And what should be the criteria for a promotion? Everything is defined by the council. And teach students, again, what is the eligibility of an admission for taking a course? What is the eligibility for a postgraduate or a PhD course? So every kind of training, what is the eligibility for a student, how much the student has to be learning during the course, academically, extracurricular, whether it is presentations or it is like culturals or sports. Everything is defined operationally by the council, the regulatory body, which is colloquially called as the council. And of course, even the research also should be regulated by the council. But in medical profession, because we have to learn from the profession which is already existing. If you see physiotherapy, the parent profession is modern medicine, the allopathy. Physiotherapy is actually a branch of modern medicine. Although we are using techniques from complementary and alternative medicine, we don't come under the alternative medicine. We are coming under the modern medicine. So when we learn from the medicine, we have a system already that is established. One, Medical Council of India. But for medical research, they have ICMR, Indian Council for Medical Research. So research is given high priority, so there is a separate for research in the field of medicine. The physiotherapist has got it from the Indian Council for Medical Research. So it's the best example to tell us that physiotherapy is actually not only just evolved from medicine, physiotherapy has to learn from medicine. So first and foremost, I am coming to this usual existing controversy of physiotherapists versus physicians. Okay? You are taking physicians as opposite side. That is totally prohibited, because physicians are beside you and you are beside them. It goes hand in hand. Both of you work together for the benefit of patients. So don't think whether a physician is better or physical therapist is better. Think of patient has to be better. So we'll do work together. That interdisciplinary collaboration is fundamental in physical therapy if we need to have anything that is successful after a regulatory body is being framed and implemented and it is existing on a daily basis. If we don't have the support of medicine, physical therapists cannot handle the council alone. Take my word. This is the best example. Remember, in Indian scenario, presently physiotherapy councils, in which all states it is there. If I am right, if it is 27 states, including the Union Territories in India, we have hardly 7 states which have the physiotherapy councils. As historically, as it is developed, if you see Delhi Council of Physiotherapy and Occupational Therapy, DCPTOT, Maharashtra Physiotherapy Occupational Therapy Council, Maharashtra State Physiotherapy Occupational Therapy Council, MSOTPT Council, Madhya Pradesh Paramedical Council includes physiotherapists, paramedical. And the most interesting, the 3 states, these 3 are actually, you know that PTOT, 2 are them, 1 of them are paramedical only. Okay. So the other 3 are individually physiotherapy. Historically again, Gujarat Physiotherapy Council, first which was framed, Gujarat State Physiotherapy Council, GSPT Council. And then the next one is Tamil Nadu State Physiotherapy Council, TNSPT, the most interesting and most what is called as the mysterious council is the Tamil Nadu Council. I'll tell you why in the later section of this session. And you see there Haryana State Physiotherapy Council. Think what? Haryana? Such a small state. Yes, of course, they achieved that after a lot of struggle from Haryana Chartered Association of Physiotherapists, led from the front by Dr. Ravinder Kumar Mudgil, R.K. Mudgil, popularly he is known as. They got the council. The problems, again, repercussion in a different dimension has happened in Haryana. They are actually suffering because of the council. If Tamil Nadu is individual council and they don't know what to do with that. Nobody knows that there is council is there only, many of the professionals. So many years have passed on and nothing is going on in that. That is the state of Tamil Nadu, if it is neutral. In Gujarat, there is a different side. The council is also controlled by the government, and with my limited understanding, it is corrupted. The Gujarat State Council has given approval to so many colleges without even an actual infrastructure. So, council, that is one side, Gujarat is one side, Tamil Nadu is another side. Tamil Nadu is like a dummy council because there is nothing that is functioning in that. But if you see Haryana, all the policies of the council are against the interest of the physiotherapists. They are trying to exploit the physiotherapists by putting very, very strict regulations. One example of that in Haryana is temporary registrations. So that means you are registering in the council, it is not lifetime registration number. You have to renew it every 2 years. And for how much of the fee? More than 5,000 rupees. You have to register for the council membership in Haryana. And it is mandatory. Everybody who is practicing in Haryana should register. Yes, correct. Of course, we are also welcoming that. Then only the quacks can be prevented. And public awareness programs parallelly should happen. The council should release press releases, TV channels and media. You have to keep on giving information that only the council registered practitioners are legally allowed or permitted to provide treatments. So then only patients will be aware that we have to go. So they have to look at a physiotherapy clinic. They see that Haryana Physiotherapy Council registration number. Okay. If it is named as Haryana State Physiotherapy Council, HSPC registration number, that should be mentioned in the board of every clinic. Then only the actual process becomes successful, because patient empowerment is important. They should know this and they have to go for it. In a therapist board, if he is putting the registration number, they have to first see that behind the therapist chair is his registration license certificate is there on the wall. And also see that that registration number should be directly verifiable in the government council website. You enter that number, you should get the practitioner's detail with the name and the area of practice, the license certification valid up to what date, what level of license it is being given. He is a basic practitioner or an advanced practitioner, or is a specialist. Have you ever thought of this? But the Maharashtra Council is making its better efforts comparatively, thanks to the efforts of Dr. Sudeep Kale. Recently we have seen so many videos educating the public in the local language on who is actually a physiotherapist and what are the things that they do, who are quacks, and from whom you should take treatments and whom you should not. But remember, the system of mentioning the registration name should come in the boards, same like registered medical practitioner, RMP number. It used to be mentioned in every physician's clinic. So same way it has to come. Then patients are protected. Like, yes, my government is taking care of me. So they have formed the council, and the council is taking care of the professionals, that only qualified first professionals should actually practice and not the underqualified. So both sides, it is a win-win story. Patients are happy, public are happy. They are part of the democracy, which is the world's largest democracy. We are boasting that it is India because of the population, the number of people who can vote. So these citizens deserve the best treatments. Of course, historically, physiotherapy professionals were regulated by Rehabilitation Council of India, all around India. when physiotherapy was only provided at the diploma level. Afterwards, when physical therapy courses have been started in various institutions, including government institutions, they started bachelor degree, which was again more than 40-50 years before they started BPT. And that BPT, the bachelor degree holders were not getting registration as a bachelor degree holder in the Rehabilitation Council of India. So that led to the what is called as withdrawal of the physical therapists who were BPT, the Bachelor of Physical Therapy, equivalent to the baccalaureate in physical therapy, globally that is termed. Whereas the diploma holders are still under the Rehabilitation Council of India. In Uttar Pradesh, the state which is there, we have UP State Medical Faculty. It's called medical. It includes physical therapy. They had diploma holders in that initially, but they now included and incorporated the physiotherapy also, BPT, under the UP State Medical Faculty. But that medical faculty is only regulating the education system, not the practice system. Okay? So license to practice and registered practitioner is not given by the UP State Medical Faculty. So that completes the list of 7 where states were potentially regulatory bodies. We have what is called as on physiotherapy. Just hold on for a moment. Pardon me for the interruption. Happy to resume again. So remember that how this every system is going through, okay, at every stage we should get an information, because there's a lot of heterogeneity in these councils. What happens globally? How many countries actually have a legal regulatory body? In some countries, the National Association itself is the regulatory body approved by the government. In some countries, the council or the regulatory body is different from the National Association. So both are happening. But they work together hand in hand again. And they are ensuring that sometimes the council is separate for accreditation alone for education purposes, and the license to practice is controlled by the association itself. Like for example, APTA, the American Physical Therapy Association, based upon which the Pakistan, our own neighbor, which we actually say that Pakistan, we talk about Pakistan in India, people look at each other and they start laughing, as if like Pakistan is an underperformer to India. But remember, in physical therapy, Pakistan is way ahead in professionally regulating through the regulatory body. And the nomenclature of the degree in Pakistan is Doctor of Physical Therapy. There is no BPT, there is no MPT there. There is no diploma there. And they have followed the structure of the APTA by spirit in having the sections of the Pakistan Physical Therapy Association. And it is again, the association itself is approved by the government, and that is the regulatory body in Pakistan. I am not going into whether the merits and the demerits of what actually happens in reality in Pakistan, but at least the system is proper from the top. At the bottom, at the reality level, any success is determined by the cooperation of the professionals, the empowerment of the patients, and the involvement of the general public. Because that is very, very important. You cannot underestimate the value of a common man. And you always see that in APTA, the practice regulations and the license to practice is given by APTA, whereas the accreditation or the educational one is done by a separate credentialing and separate accreditation council like FCCPT. So remember that however it functions, but most important thing is the structure. After the structure comes, what is next is the responsibility of every level, and then the strategies to implement that by taking inputs from everybody all across the country democratically, and then implementing it. It should not happen like how it happened in Haryana. I'm really, really I'm telling you, Dr. Mudgil is also giving his fight on a daily basis. He's been, and his brother as an advocate, okay, he's been always lobbying for the modifications of things. But it's very tough fight, and I don't think anybody in India can even imagine to be 10% of Dr. R.K. Mudgil to have that willpower to fight. Nobody is such a fighter. I have never seen one among physios, at least in my life, for 4 decades and 2 decades as a physio. Okay, I have not seen anyone like that. He is like the, what is called as the Netaji of physiotherapy. Okay, we have a Mahatma Gandhi in our Indian physiotherapy, that is Professor Uma Shankar Mohanty. Okay, so one who has gone into the Satyagraha, the walking march, he has done so much for the protests, and it's phenomenal. Okay, how Indian physios, very few people who have been lobbying every time for an independent physiotherapy council over the years, because as we withdrew from the rehabilitation council, the next responsibility comes to the independent council. But the point is, whenever the issues were represented to the government, there were conflicting information that was provided by one group of people. If they are providing, another group is providing another information parallelly. Lots of associations in India, and they are giving conflicting information. Governments change meantime, and it was just moving on from summer to winter session and winters to summer session again and again. And none of the bill for an independent physiotherapy council was approved. National level. Okay. We were having high hopes because the ruling government is the one who established, the central government is the one, the union government is the one which established the individual or the independent physiotherapy council in the state, when the same Prime Minister was the Chief Minister of that state in Gujarat. So we had high hopes that we'll get a independent or a central physiotherapy alone council. Okay. But the point here is, the basic, what I was telling you, we are part of medicine. This was the one which was misunderstood by some physiatrists. I say physiatrists, physical medicine and rehabilitation, MD or diplomas. So what they do is they started dictating too much on the physical therapists, especially in Kerala. And they got into a heated argument which went to the High Court of Kerala, and after that some of the physiatrists even were objecting that why physical therapist is referring a patient to an MRI. So that led to the High Court of Kerala's order that physiotherapists cannot prefix doctor. Till then everything was fine. And then the Kerala branch of the Indian Medical Association, not the Medical Council of India, Indian Medical Association. Okay, Medical Council of India is a government body. This is a non-governmental organization. It's a group of professionals. But IMA is a very strong body. They actually work for the welfare of the doctors and physicians more than the MCI. MCI actually tries to provide the rules and regulations, but IMA ensures that the rules and regulations are reaching the people, rules and regulations are benefiting the doctors, rules and regulations, whether they need modification, that is always recommended or even sometimes protested, frequent protest always done by the IMA, the unity. In dentistry, after the medicine, we also have Dental Council of India and we have Indian Dental Association. Both are there. So both has to work hand in hand. You can't say that council is there, our problem is solved. We need a strong association. We have a very strong association in India, the Indian Association of Physiotherapists, okay? The largest body. It had its own issues in terms of the duplication of the association by two different set of professionals proclaiming that they are the IAP Okay, so it was happening for some years in between, and because of that, Indian Association of Physiotherapists was disqualified from the membership of the global organization, World Confederation of Physical Therapy, because WCPT was unable to identify who's actually the genuine one among the two. This also happens. Okay, this WCPT only, all the countries, all the legal regulatory bodies of all the countries are the largest associations. Council means, you know, legal bodies which is government approved. Associations are government registered, but they are private organizations. So those, everybody, largest association also can be member of WCPT. Okay, not just the government organization alone. So in that, IAP, the Indian Association of Physiotherapists, is also the member of WCPT. So at least because of this, we have a global, what is called as a perspective of, okay, Indian physiotherapy scenario. There is an association which is the largest body, and that gives some kind of operational definitions and guidelines. And WCPT is happy, or when we go to another country, they are happy that if you are a member of IAP, it means that you are a member of an organization which is a member of WCPT. So your credentials, anyway they are going to tell that Indian credentials are lesser, especially when you are going to US or Australia or even the UK. They are going to tell it's less, but at least they were accepting people because we are a member of the WCPT. But later, when the exit of WCPT happened in the meantime, because of the dual or the duplication of the IAP, so because of that, many professionals were in confusion whether to register and which one to register. IAP membership is lifetime, and it also gives license to practice. IAP has provided the guidelines for education, curriculum, research. There's no funding in the IAP for research in those days when it was dual or before that, where I am telling 2010 and 11. Okay, so those years, and afterwards, if you see, approval of colleges, everything was done by the IAP. So it was actually kind of work which was going on at national level, but it was not much successful because people used to discourage that by saying that you are not a government body. None of the physicians or none of the doctors ever questioned the IMA, Indian Medical Association, that you are just a private body. Never. I'm happy that I could resume back again. Okay, right. Pardon me for the second interruption. Of course, allow me to just silence this phone, as we are not expecting any more calls. Okay, right. So how that split, what happened after the split, is something which is much more significant. Exceptional contributions by few physios from Karnataka, especially Dr. Iftikhar Ali, led to the two factions of the IAP, one led by Professor Umashankar Mohanty and the other led by our own Dr. Ali Irani, were made to discuss with each other, come to a common conclusion for the best benefits of the profession. And the talk was led by, again, our very own Dr. Sanjeev Kumar Jha. So Dr. Sanjeev K. Jha, who was part of the Central Executive Committee of the IAP for so many terms, and he had the best line of thought to communicate with both of them, to take it forward, and the merged IAP came into existence. The merger itself is a huge success for the Indian physiotherapy professionals, and following which the conflict with the WCPT, or the ambiguity in the WCPT, was cleared through the efforts of Dr. Ali Rani, and IAP, the Indian Association of Physiotherapists, got its entry back in as the member of the World Confederation of Physical Therapy, but the organization was renamed as World Physiotherapy. That was the name. The new name of the WCPT is World Physiotherapy. So we are actually now in a better situation because of two things. One is the repair work, the merger, and the second is re-entry into the WCPT. But we are again back into the same stage as it was before. But the difference is the people are in a different frame of mind. Parallelly, the developments in the government itself, it's not because of the lobbying or because of the efforts of the people. Government itself wanted to regulate all the allied health professions all around the country. So they framed the bill, which is the National Commission for Allied and Healthcare Professions, NCAHP. Of course, there was, before this, there was another National Commission for Human Resources in Health. A lot of things were framed, the bill was framed, nothing was getting approved here, it was getting postponed here and there. So now during the COVID lockdown, in the early phase, this bill, and afterward this bill is successfully approved and it has become an act. So that is the best news that India can have. National Commission for Allied and Healthcare Professions. So this commission actually tells some kind of definitions. Of course, the physiotherapy definition is autonomous, independent practitioner. You can evaluate and read. But I am not going for independence by staying alone. Independence means work together with your own system or way of functioning. One is not going to interfere in the functioning of the other. Okay? So what I feel is the interdependent is much better than independent, because nobody can be independent. If you are thinking that human beings can be independent, never. The human being always has to depend on another human being. If they are totally independent, staying alone means you will become mad. You are not a normal person. Okay? If you are doing something like a great scientist and you want to evolve a new technique and you are totally working alone for 10, 12 years, long hair, bad, everything, and you work on it and you are doing also, you want to share that work with other human beings so that other human beings benefit or they at least appreciate you. So you can't say that you are independent. Okay? We are all interdependent to each other. So one thing you remember, teachers are dependent upon students, students are dependent upon teachers. If there is no student, there is no teacher. And if there is no teacher, students can learn, but they cannot learn the best. Okay? So everything is about an interdependence. So always when we come to this perspective, the National Commission has defined that every profession will have its own council. So what do they mean is, it will not be like a mixed one, an umbrella council like all professions are there. It will be like individually. And some of the major professions are identified and physiotherapy is permitted to be as a single physiotherapy council nationally, and every state can establish their own state physiotherapy councils in line with the National Physiotherapy Council, and they will actually function under the National Physiotherapy Council from top to down, and they will also get back with the inputs related to the state from bottom to up. So that is democracy. So that is the structure that was told, and there was a 6 months time period that was given for the states to create the regional councils. And of course only Uttar Pradesh, the state, has actually got that in paper now that the State Physiotherapy Council will be formed. The State Health Minister has given thanks to the works of Dr. Santosh Pandey. So remember that, of course, there are works going on in Jharkhand, that there also independent council might come, Bihar it might come. So there are lots of states where there is potential for Orissa also. Okay, so there came on approval level. So there is independent physiotherapy councils getting formed parallelly. Okay, so they are everywhere. Chhattisgarh also has a physiotherapy council in combination with the occupational therapy council. So pardon me for missing it out of the first list. So remember that the PTOT, we have 3 states. One is the Delhi, Maharashtra and Chhattisgarh. The paramedical is Madhya Pradesh. Earlier Madhya Pradesh was together. Afterwards it became Chhattisgarh. And next we have the independent councils of Gujarat, Haryana and the question mark of Tamil Nadu. And you see that in formation also there are 3 more states which are coming up with councils like Jharkhand, Orissa and Karnataka. There were talks in Telangana, but I am not updated with the progress yet. Okay. So what we need to know now at this stage is we are going to a transition phase. How do we prepare ourselves best for that? First and foremost, and of course, the final is always the individual responsibility. So as an individual physiotherapist, what you can do rather than just waiting for things to happen. First, are you a teacher or are you a practitioner or are you a student? Getting membership from the Indian Association of Physiotherapists makes you part of the largest association in India and of course the part of World Confederation of Physical Therapy. Unless there is another organization in India which comes up with larger membership than the IAP and is also ready to pay the money, the fee of WCPT, because WCPT charges a very, very solid fees, every member per member fee. Okay, so that I don't think any other association in India can pay that amount other than the IAP. So it's part of the WCPT. So taking IAP membership is always good at this present stage. Be it a student member, I think they are offering the memberships free of cost, so students can become members. But remember that is a global identity. But you need to be a part of an association where you are actually learning progressively, filling the gaps of education that is there in the colleges which you have not learned. So you have to join some other educational bodies. Take its membership, get the benefit of discounted courses, take a membership from an organization which is globally known so that your membership in that educational institution, education related like foundation or a federation or an association or an academy, definitely it will help you a long way in showing that your credentials are much better than just the BPT or the MPT which you have done in the colleges. So you need to do some extra courses. So do the courses from registered organizations. There are many organizations like that. AOMPT is one such organization where we are providing not only orthopedic or manual therapy courses, we are training neuro, we are training in cardiopulmonary, we are training almost in every aspect including pediatrics in physical therapy. So don't worry about that. And think of this, that learning is something which is very, very important. Even if a council comes, the council will tell that annually you have to maintain these many credits. As much as you are maintaining those credits every year, then only your license stays active. Otherwise it gets expired and you will have to fulfill the credits within 3 months so that you can get back your membership. So this will come, whatever council comes. So be prepared to learn on a regular basis. Formally, official learning, not just watching YouTube and then learning from those videos. Of course, you can do that at leisure. But you know, it's a grey knowledge. It does not tell everything in black and white, nor it describes the knowledge, the glory of knowledge in every color. Okay? So remember that. Prepare yourself for learning, lifelong learning, ongoing learning, continuing professional education. So after degree also you should do the courses. Some people tell, why do we need to do an extra training when we have already got the degree? But remember, that knowledge was evaluated with exams. Afterwards you are practicing. After 5 years, do you remember what you learned? So that is why this learning and also the developments would have happened in the field scientifically, newer techniques. So that is not part of the degree. So you will have to learn that. And you have learned the technique, you are a certified practitioner, it's not the end of the story. After 5 years, that same technique could be upgraded. So you need to do another recertification. Although there are a lot of commercial aspects involved in this provision of courses, the credentialing, the certification, the license and everything, remember that it gives you legal protection, distinction in the professional identity, and of course your own development also, because you become better person, professional, okay, automatically. Doing the courses is not just a waste of money, it's an investment for your betterment. Same like how you paid for the BPT degree. So remember that how much you use it, you become better. You use it less, you cannot be becoming better. So the learning is primary. The next thing is, at state levels, try to approach the state level authorities, the government authorities especially. Now they have extended the time another 6 months, I think, because of the second wave and plus now Omicron scare. They are also predicting the third wave in India now. European countries have already entered the third wave. So we are preparing a 2022 with again a mixed journey, roller coaster ride, but a year which is better than 2021 in terms of deaths, definitely, thanks to the vaccine, thanks to the cooperation of the public, and of course everything is in the hands of the supreme power and the destiny. So what we need to do now is, if you are a student, yes, of course, make sure that actively learn both in college and also outside, because the curriculum is not the one which is including all the advanced techniques, so better train that. If you are doing masters, it's mainly for education orientedness, and in the masters you have some experience, extra experience about research, which can build your fundamentals towards doing the PhD. So this is the track. As of now in India, we don't have Doctor of Physical Therapy as an official approved program in India anywhere. So we are not into a phase where we can legally prefix doctor or not. But conventionally, because our Indian Association of Physiotherapists has told that, definitely you can also prefix the doctor. Obeying that I am a member of that association, my association tells me that I can prefix, so I prefix doctor with the suffix PT. So Dr. Senthil P. Kumar PT. Well, it's fine. If I don't want to prefix doctor because I have a better designation for myself, so you would have seen me that I prefix only professor, because professor is years of teaching, beyond 12 years, then only you are professor. Doctor is an MBBS, fresh graduate is also doctor. So I do not prefer to prefix doctor, but I give the doctor prefix to a BPT who is becoming a member of AOMPT. Definitely, in internship itself I call them doctor. Okay. So remember, we are part of medicine. Learn to behave respecting the medical professionals. Develop your communication skills so that you don't get into friction with mainstream medical professionals. If you are having friction, you cannot do anything. It goes to even people in Sri Lanka, for example. Make sure that the mainstream medical professionals are actually, they are the mother profession and we are son or the daughter profession. So remember that. So we should understand that mom is always mom. M for mom, M for medicine. Don't just get into arguments and fight with them for supremacy. It's a dead end for physical therapists. If you also see, that the way forward, make sure that educate every patient of yours, create a YouTube channel for your clinic, create public awareness about qualification of people, how a trained individual versus an untrained individual will be, and most importantly, tell this one sentence to the patients that a physical therapist who is treating you without examining you is a quack. Examining not by MRI or CT scan, examining by physical examination, manual examination. If they don't do that, in spite of having degree also, they are a qualified quack. I repeat that word, qualified quacks. Because there are some institutes which provide the degree without any kind of education. In fact, even students need not go there, they still get the degree. So people are having the degree. Having the degree does not mean that they are legally permitted to do everything. Okay? So empower your patients that if the therapist is not evaluating you, examining you, not educating you, the therapist is not empowering you, the patient has to be empowered, then they are quacks. And so that is the only difference between a technician versus a clinician. A technician is concerned more with the techniques, whereas the clinician is more concerned with the patient. If my words sound harsh, I will not extend any apology, because what I am saying is absolute truth, pure truth. Because a diploma holder also can sensibly treat the patient with examining, educating and empowering the patients. The 3 E's. Examining, educating and empowering the patients. Clinician, they can be a better clinician than a person who is trained in osteopathy or chiropractic and showing the patient the 3D scans, electronically operated tables or tools, and give the treatment directly. They might have Doctor of Chiropractic degree, they might have Doctor of Osteopathy degrees, but ultimately they are technicians because they are not examining, educating and empowering. Empowering patients also includes that active rehab. Patients to become normal by functionally oriented treatment, not structural. Don't show them vertebral body and tell that disc is slipped and I am fixing it. Take the MRI before and after and show that MRI has become normal. It does not matter anything at all if the patient cannot again bend and lift the weight. Are you understanding what I am trying to tell? That functional perspective comes in physical therapy, and the foundation is biomechanics. Extend that into pathomechanics and upgrade your skills, of course, and do a sensible periodic writing articles in the newspapers, like we have our executive committee vice president, like Dr. Pooja Digra. She does that work in Jammu Kashmir. And you also see that the YouTube channel, like Dr. Ritu ma'am, who's always doing through awareness through her YouTube channel and also periodically taking webinars. What I am trying to tell is, get the public with you. Okay? Let them respect the physiotherapy profession. Let them also recognize who is the genuine clinician. Not by their qualification, but by their qualities of clinical approach, examination, evaluation, strategized progression of treatment, and functional orientation. So these things, perspectives. Sometimes you might see that the topics are already there in the PPT, so why should I learn that? Never underestimate an instructor who already has a global presence. You first search about the instructor, online, you will definitely see their videos in YouTube, whichever is free. Realize the truth that this instructor is definitely providing extra. So don't ever underestimate them by telling that these topics already it is there in BPT, why I should join this course. Topic may be there same, but the way two people teach us are totally different. Right? Inputs, comments, other than the good evening, good morning or feedback is most welcome now, so that we can have a short interaction to close this session now in another 10 to 15 minutes. So this national body is going to establish, and when it is getting established, it will say some guidelines and we are bound to follow that. You cannot say that it is telling, okay, then it is a failure of the Central Council, unless you cooperate and you do better. There will be strict regulations, okay? You might have to document more in your clinical practice. That documents may be audited or the inspection can be done periodically by the council. So make sure that learn things, prepare to restart your professional life. When it comes to education, don't think that the same topic you can be teaching every year. Learn the new things. Although syllabus do not tell you topics, that these topics you have to teach the new topics under the old topics. We are going to see further webinars, and I am going to definitely include the untouched areas. I hope today's session was a historical evolution of perspective regards to the council and the regulatory body from an Indian perspective, but extending our information to the medical profession and also the global scenario of physiotherapy, which the topic was intended to do. Also, inputs are definitely more important, and make sure that we have our core committee member, who is Dr. Ajay, who has done a medical degree and he has done a physiotherapy degree. Very few you might have known in India like this, who has completed an MBBS and BPT together. Okay, both. First he completed MBBS, then he did the BPT. So remember, after doing mainstream medicine also he felt the necessity that yes, I have to do physiotherapy, because without doing physiotherapy I cannot fully comprehensively treat the patient. So that led to Ajay sir doing the course. These are the inspiration, the breath of life, positivity that we observe from each other, take the best features of each other and inspire each other. Wishing the executive committee members who are present, Dr. Darshana, Dr. Ritu, Dr. Ajay, Dr. Pooja, Midunil from Sri Lanka, Dr. Girish, another passionate and sincere physio. Wishing you all the best of 2022. God bless you all, and keep the brightness of knowledge glowing forever through your works. Happy New Year 2022.